Everyone, Steve Hartline for Talk 1013 The Buzz and Mix TV, and I'm joined by Dr. Richard Besser. He is the president and CEO of the Robert Wood Johnson Foundation, a position he assumed in April of 2017. He's also the former acting director for the Center for Disease Control and Prevention, and a lot of people remember Dr. Besser at ABC News, where he was the chief health and medical editor. Dr. Besser, how are you, sir?
I'm doing really well. It's great to be here, Steve.
Well, thank you very much. Well, you know, and I know we have a topic we're going to discuss about your foundation that you lead, but I have to ask you while we have you, where are we, in your opinion, in this pandemic?
You know, Steve, I think we're in a really challenging place with this pandemic. And the reason I say that is that we have several vaccines that are extremely effective, extremely safe. And we're hitting a bit of a wall in terms of people's interest and desire to get vaccinated. And it's hitting some states harder than others. You know, I know that Tennessee has been hit really hard. And you know, I led emergency preparedness and response at CDC for many years, and one of the things we looked at as a success factor was when we could come together as a nation. But we are more divided than ever when it comes to the response to this pandemic, and I worry that is going to continue to cost thousands of lives that could be saved if people would take the public health measures that we know work.
Well, it's a very timely interview with Dr. Besser. Dr. Richard Besser joins us. The FDA has approved now, just yesterday, boosters for people 65 and over, also those who are at higher risk for severe disease. And the organization that you used to, you were the acting director of the CDC, they're meeting today as we tape this interview and looking at it. What do you make of the decision yesterday and what the CDC is considering? And then also, what about the rest of us as far as a booster is concerned?
Yeah, so I think that the FDA made a smart decision in terms of recommending boosters for people 65 and older, people who are at increased risk for severe disease, and people who work in occupations that put them at increased risk. And the reason I think that's smart is that there is growing data that in those groups we're starting to see challenges in terms of levels of protection. This is going to be a challenging communication issue, though, for the public, because the FDA only had data to look at one of the three vaccines that people have been getting, and that's the Pfizer vaccine. So these recommendations are only going to apply to people who got that vaccine. For people who received the Moderna vaccine or the J&J vaccine, they're going to have to wait until the FDA has the information and has looked at that. I expect that the panel that advises CDC will come forward and recommend booster shots for some. We'll have to see their look at when they look at the data exactly which groups they recommend get those boosters. But I really like to stress when people start talking about boosters that what's going to get this under control in America the most isn't boosters. It's going to be helping those people who haven't got vaccinated get the information they need, and seeing more people who are unvaccinated getting their first rounds of shots. That will really help protect those people, their families. It'll help protect children who don't have access to vaccines. That's a big concern for me.
Well, Dr. Richard Besser is the president and CEO of the Robert Wood Johnson Foundation. And Dr. Besser, an unbelievable headline: more than 2 million adults in the United States have no health insurance. And really, it's based on where they live. Tell me about that.
Yeah, so the Affordable Care Act, when that was passed, it was an attempt by the federal government to increase the number of people in our country who had access to high quality health insurance. We're the only wealthy nation that doesn't guarantee that for everyone. But so there were tens of thousands of people without health insurance, and the expansion has gone a long way in reducing that number. But right now there are 2.2 million people in our country who lack health insurance because their states decided not to expand the number of people who got covered under a federal state program called Medicaid. At 2.2 million people who would have coverage if those 12 states increased the access to that life-saving program. We've seen in the 38 states that have expanded coverage that it leads to improvements in people's lives. It has economic benefits, but there are 12 states that have yet to provide that to their residents.
And so your foundation, the Robert Wood Johnson Foundation, is urging Congress to correct this in the what is being debated, the reconciliation package.
Yeah, there are many ways to close this gap. The American Rescue Plan Act that was passed earlier this year provided additional support to states for this coverage. The initial Affordable Care Act provided 90% of the dollars that states would need to provide this health insurance. The American Rescue Plan Act provides additional incentives on top of that. So there are a number of ways that Congress could do this to close that gap, but it's important that they do. It disproportionately affects people of color, Black and Latino Americans, but it hits Americans of all races, of all ethnicities. A large proportion of people who are missing health insurance because of the lack of expansion are working people. They're working in jobs that don't provide health insurance. Many people are working more than one job, and so none of those individual employers is providing health insurance. And there are many people in this group who have disabilities who really need that coverage to get the services so they can lead a full and complete life. So this is something we need to address as a nation. We need to get past the politics and provide for people's health.
And Tennessee being one of those states.
That's right. In Tennessee, over 100,000 people would be covered if Tennessee expanded their Medicaid coverage. And it's so important that the people of Tennessee understand the issue, understand what is politics and what is facts, and make a decision where they come down. You know, when I look at the data, what I see is that expanding Medicaid improves the quality of life for people. It improves the length of life. It improves the state economies. It improves housing. One thing we've seen is that when you expand Medicaid, the number of people who get evicted goes down. And it's like, well, what's the connection there? Well, if you're somebody who has a medical emergency and you're having to pay your medical bills, you're going to have to pay those bills, and you may have to miss some rent payments. You may have to miss some mortgage payments. And that can lead to eviction. You may have to decide not to give your child a healthy meal. And because you have to pay that medical bill. These are decisions that no one in our country should have to make.
Dr. Richard Besser is the president and CEO of the Robert Wood Johnson Foundation, but also former acting director for the CDC, and he was the chief health and medical editor for ABC News. Dr. Besser, it's a real privilege to have you, sir. Thank you very much for your time.
Thank you so much. It's been great talking with you, Steve.
Thank you, sir.